Hi, this is Dr. Jason Dulac coming to you from my office in Springfield, Virginia, Dulac Dental of Springfield. I get a lot of questions about x-rays today. I'm going to try and answer some of those questions for you. What is a dental x-ray? X-ray allows us to show areas of the tooth that I can't see visually. So the jawbone or the root of the tooth or in between the teeth where I can't see where cavities might develop. There are a couple different types of x-rays. The bite wing x-rays, we get to show between the teeth where I can't see visually to see cavities between the teeth. Then there's periapical x-rays, which show the whole root of the tooth. And then there's a panoramic x-ray, which shows the whole jawbone. Sometimes we'll catch carotid calcifications in that as well, and it allows us to look at the joint as well. And the best type of x-ray is a 3D x-ray or cone beam CT. We do have that here in the office. Typically, x-rays are covered by insurance. 3D x-ray is one of the few that's not on occasion. We have a couple carriers starting to cover it now because they see the value of the diagnostic quality. However, a lot of them don't. A 3D x-ray shows the teeth in slices in different planes so that I can see exactly what's going on. So if you're getting a root canal and I want to see how the nerve goes through the tooth, or if you have something going on up in the sinus, that's not something that can be easily visualized on a 2D x-ray. Or if we're worried there might be an abscess or growth or something going on, a 3D x-ray is great. They're also the standard of care for dental implants. I do place implants in the office, and we'll always get a 3D x-ray prior to placing an implant. It helps us measure the bone in a couple different dimensions. Like I said, you can see slices through the x-ray in multiple planes. It takes me about half an hour to read a full CT, but it shows a lot. It shows the airway, the adenoids, tonsil stones, carotid body calcifications, the sinus, the teeth, the roots, the jawbone, any pathology that might be going on there, salivary stones on occasion if you might have one. There's a lot that it shows. It's a very high quality diagnostic x-ray. Dental x-rays are the standard of care. You can't make a diagnosis or do treatment without an x-ray. I understand people do have concerns about x-rays or exposure from x-rays. We take x-rays in the room with patients all the time without vests on. The dose or exposure is so minimal now, it's almost immeasurable. Full set of x-rays would be similar exposure in terms of carcinogenic potential of spending a full day in the sun in the summer or a flight across the United States. So I understand radiation is a concern for some people, but the dose is so small now. We are fully digital in the office. Digital x-rays allow us to process them quickly. There's no film to process. They're immediately processed. And the dose is very, very small. And any x-rays that taken outside the head have extraoral intensifying screens. So we've really come a long way in terms of exposure and safety in dental x-rays. X-rays are always included as part of an exam or diagnosis. As I mentioned, there's x-rays that shows cavity between the teeth, around the root, up in the sinus or around the head and jawbone, or the 3D x-ray. Depending on what we're trying to see, we may request a different x-ray or multiple x-rays to get a good idea of what's going on. They are the standard of care for dental treatment. Your insurance will not pay for any of your treatment without an x-ray, and it allows us to see things we can't see visually in the mouth. I hope this answers some of your questions about dental x-rays. If you have any further questions or want to schedule an exam or consultation in the office, please give us a call, 703-451-4500.